Hi, I'm Dr. Shan Tang, and today I'm going to talk to you about sinus disease and some of the procedures we can use to treat it. First of all, the sinuses are actually air pockets within the bone of your face. There's 4 sets of them. There's the maxillaries in your cheeks, the frontals in your forehead, the ethmoid cells in between your eyes, and the sphenoids, which are more or less in the middle of your head. All of your sinuses should be connected to the actual air passages within your nose by tiny passageways that are about 1 to 2 millimeters wide in a natural healthy sinus. When you have sinus disease, these passageways can become clogged. And what you feel is nasal congestion, you can feel the lack of smell, and you can definitely feel pain and pressure in your sinuses and headaches as well. And so if you have a lot of these symptoms and it just happens once, you can always treat that with antibiotics and possibly steroids and allergy medications. But if it happens over and over again, it may be a time to get a procedure done. When your sinuses are diseased, the passageways that connect them to your nose are closed off, and balloon sinuplasty is a way we can use to open them back up. When you have the procedure in the office, your nose is first numbed up very well using only topical gels, and then we place the apparatus in your nose under guidance of cameras as well as a CT guidance system, which shows us where the catheter tip is in real time. The catheter goes into that passageway, which is closed off into the sinus, and then we advance a balloon over top and dilate the balloon. That pushes the opening from a closed passage into a 6 millimeter wide passage. We then take everything out of your nose, leaving you with a nice wide opening into your sinus. That way the next time you get a cold or an allergy attack and you have a little swelling, that doesn't close the sinus off. The recovery after a balloon sinuplasty is fairly straightforward and easy. Usually people can go back to work the very next day. You'll have to spray some saline spray in your nose and do some rinsing just for hygiene and for cleaning the areas that are healing, but typically it's not very painful and you just take Tylenol or Motrin after. The long-term benefits of balloon sinuplasty are really for prevention of future sinus infections and chronic pain and congestion in the face. Once you have those passageways open, it is easier to get sinus rinses and medications in there. It's easier for you to breathe through your nose, and you get rid of that pesky pressure and pain and headaches. Balloon sinuplasty is covered by most insurances. It does require that you come in for an exam first so that we can look in your nose and document the findings, as well as get a CAT scan to see what the internal passages look like. If you'd like to learn more about balloon sinuplasty, please visit our brand new website, fayeent.com, or give us a call.